My name is Dr. Jonathan Miner. I am Associate Professor of Medicine at the University of Pennsylvania, Perelman School of Medicine in Philadelphia. I'm also Director of the RVCL Research Center at Penn. And it's been a while since I uploaded a video, and I owe everyone an update. So my plan is to do a series of short videos over the course of the next couple of weeks. For informational purposes and also to keep people updated on our work as we are working day and night and on the weekends to develop a personalized medicine for patients with retinal vasculopathy, with cerebral leukoencephalopathy, RVCL. And we believe that we're going to be able to achieve this. We have made huge progress over the last couple of years. I moved to Penn just 2.5 years ago. And at that point, we had nothing in the pipeline in terms of a therapy. Now we have gene therapy, small molecule drugs, which could be taken as pills. We have demonstrated on multiple levels how these can be protective in cells growing in addition in the lab and now in model systems. And so we're extremely hopeful that we're going to be able to bring these toward clinical trials in the near future. I'll provide more on the updates on that in my next video. In this video, I would like to focus first on preimplantation genetic testing and how this technique is available for patients and families affected by RVCL, what it means, how it works, and then to let everyone know that you can reach out anytime if you have any questions about this or anything RVCL related. So what is preimplantation genetic testing? So within the human genome, there are 20,000 genes and 3 billion bases, A's, T's, C's, and G's that are like rungs on a ladder. The DNA in a single cell is so long that if you imagine it the size of a spiral staircase, it would extend all the way to the moon. I think I've used this analogy in previous videos. But the key point that I want to emphasize is that RVCL happens because of one extra letter out of 3 billion in the wrong place in the middle of the TREX1 gene. And so as far as developing therapies goes, we have to target that gene, that one extra letter, or target the protein, which is encoded by the gene. But in addition to that, there are ways to do genetic testing in adults and also in the context of in vitro fertilization. So what is preimplantation genetic testing? So preimplantation genetic testing is for those who choose it, patients with RVCL who want a chance to ensure that they do not pass on the dominant disease-causing TREX1 genetic variant or mutation to the next generation. So the way this is conducted is by in vitro fertilization, and then the embryos are cultured for a few days, and then a small biopsy is done. This does not harm the embryo. It remains intact. And then this small biopsy of the 3-day-old embryo, it then undergoes genetic analysis to determine whether or not the embryo has the disease-causing TREX1 mutation. So the important concept here is that RVCL is dominantly inherited. And the way it works is that there is a 1 in 2 or 50% chance of passing it on to each child. And so by performing preimplantation genetic testing, parents can then choose an embryo that does not have the disease-causing TREX1 mutation, and they can select that for transfer to the uterus. So basically, it's in vitro fertilization, just like couples with fertility problems undergo in vitro fertilization, but there is an additional step, which is a small biopsy of the embryo followed by genetic testing. So this is a video illustrating how preimplantation genetic testing works in terms of the biopsy. So here you have a 3-day-old embryo. This is a biopsy performed at Penn, and you can see that they basically take a cell from the 3-day-old embryo that can then be subsequently analyzed by genetic testing, and the embryo remains intact. It has no impact on development. And so it's not uncommon for families to choose this as a path for ensuring that the next generation does not inherit the mutation. Now, these decisions are personal, and I, as a treating physician, completely respect everybody's personal decisions about what they would like to do, but I also want to make sure that people are well informed and that they understand that this is available. It's done at numerous institutions around the world, and we can facilitate this if people choose it. And then furthermore, I think some people wonder about cost barriers, those sorts of things. It's important to know that in our experience, we've seen that health insurance will cover this for people. Obviously, I can't speak to every single type of health insurance all around the world, but thus far, what we've observed is that health insurance will cover this for families affected by RVCL. Finally, I want to make sure that you can reach out to us anytime. We are working toward a cure. You can follow us on X. We have our website here at Penn with a lot of information about the disease. RVCL.org, which is run by the Clayco Foundation, who, by the way, provide tremendous support to us and others all around the world. You can visit their website, which is recently revamped, RVCL.org. We are one of their institutional partners. You can call us directly. We have an RVCL phone line here. You can reach out to me anytime via email. I recommend not including any protected health information in the email. Just reach out. If you want me to give you a call, let me know. I am happy to call you anytime. And I will follow up with additional videos about our work on developing therapies. Finally, I want to thank all the patients and families for your engagement, as well as our collaborators around the world. And importantly, many families and the Clayco Foundation have provided tremendous support for the work that we are doing here. We would not be able to advance the development of personalized medicines for RVCL without your support. And I want you to know that I'm completely committed to developing a treatment for this disease. We will leave no stone unturned until that is accomplished. And I'm looking forward to providing my next updates about therapies. Thank you.